In 2023, the primary healthcare sector started a process that looks set to bring about the biggest reform since Medicare was created in 1984. For the past couple of years, Northwestern Melbourne Primary Health Network has been at the forefront of significant changes to the service landscape. In particular, we've overseen, on behalf of both Australian and Victorian governments, the rollout of general practice respiratory clinics and priority primary care centres, not just in our own catchment, but across the state. Respiratory clinics are now winding down as priority primary care centres and other new services become embedded. PHNs continue to play a central role in healthcare innovation, not least through the rollout of My Medicare, the integration of mental health services, and through growing roles in aged care and allied health.
As a GP at the coalface, I understand how a voluntary patient registration scheme will build closer, accountable and measurable connections between practices, GPs and patients. Northwestern Melbourne Primary Health Network has long advocated for a patient-centred model that boosts access and continuity, supports comprehensive multidisciplinary care, promotes preventative measures, decreases duplication and improves patient experience, and also reduces provider burnout. My Medicare won't do this on its own, but it's a necessary foundational piece.
A similar flex is underway in mental health. Of note are the Victorian Government's local mental health and wellbeing services. As a major funder and co-designer of mental health services, we have several roles to play here. One is to work with all service providers to ensure that welcome additional capacity doesn't result in fragmentation and poorer support for clients.
Everything we do at Northwestern Melbourne Primary Health Network is driven by the quintuple aim of healthcare. This is an international framework that describes 5 principles of improvement in healthcare reform. It's about the patient consumer experience, the provider experience, health outcomes, cost efficiency and sustainability, and importantly, health equity.
It's important to remember that these objectives are all equally important. In this annual report, you will find a small selection of stories about us and some of the organisations we work with presented according to the quintuple aim. You will notice that many of them could happily fit into several categories, and that, we think, is a mark of success.
Talking of success, 2022 to 2023 has been a huge year for us here at Northwestern Melbourne Primary Health Network. Chris and I would like to thank all of our staff, our board members, our expert advisory groups, our clinical and community councils, our people bank, and importantly, the thousands of residents who help shape our work. Thank you.
Most of all, we'd like to thank everyone working in primary health for providing better care every day for everyone in our community. Thank you.